Happy Naturopathic Medicine Week, everyone. I am Dr. Sayre Lindberg, and I am a naturopathic physician that is practicing in Paulsbo, Washington currently. And I just wanted to give you guys some information about who I am and who a little bit about just who your doctor is. So I was born in a small town in New London, New Hampshire in 1992. And then I ended up moving to Pennsylvania to finish up my bachelor degree in health science with Philadelphia University and also played on the tennis team at the time. I then took a year off before going to medical school and practiced as a medical assistant at a community clinic. And that is when I found out about naturopathic medicine. So then I went to finish my doctorate of naturopathic medicine at Southwest College of Naturopathic Medicine in Tempe, Arizona. And there I was also the president of Energia Club, which is an energy medicine club. And I also got my Usui Shiki Ryoho Reiki Master certification. And I was able to do that certification actually with my sister, which was a pretty powerful experience. After I graduated naturopathic school, I did a preceptorship with Dr. Judith Zeil at Journey Natural Medicine in Chandler, Arizona, and then found myself moving to Paulsbo, Washington to be a provider with Sound Naturopathic Clinic. So that brings us to the present day. And so I typically get questions asked to me typically of why did you do natural medicine, or how did you even get into this route? So I thought that I would give you a little bit more of a backstory of why natural medicine and why I chose this route. So I've always wanted to go into medicine, especially having parents both be in the medical field my whole life. I actually ended up going to physician assistant school after I was doing a trip, more of a community service trip in Nicaragua. I decided that I wanted to go into the physician assistant route and really pursue medicine. But I ended up leaving and not finishing the PA school because I wasn't enjoying how medicine was being taught. I was being made fun of for bringing green smoothies. I wanted more of an emphasis on nutrition and preventative medicine, and that wasn't being emphasized in the physician assistant school. So I decided to be a medical assistant and to kind of help me figure out what I really did want to do with medicine. I have always been outdoorsy and I've loved learning about medicinal properties of plants. And I believed that traditional medicine has been used for thousands of years for a reason. I was also an athlete and understood the importance of nutrition. And I just didn't know how to combine the love of nature, nutrition, alternative medicine into one profession until I found naturopathic medicine. I feel like the world aligned when I found out about the program. But at the same time, my mother took a bad turn with her cancer. She had breast cancer when I was in seventh grade, and she's just been battling on and off different cancers for 13 years until she actually succumbed to cancer. But I saw how conventional medicine was being utilized on her, and I just saw how debilitated she was with her cancer treatments and her quality of life. And so, being a newly inspired medical student, I told her to try some alternative cancer treatments in Arizona, And the program that she was in actually gave her hope and a better quality of life, even though she was at the end stage of her cancer diagnosis. And not only do I think that just being on a natural route and route helped her with her cancer and her quality of life, but the actual hope that she had when she went to this program, which was with a naturopath, was very meaningful to me. Every other doctor that saw her just gave her bad news and wasn't very optimistic. And the naturopathic doctor that she saw actually told her enough that she felt comfortable and had hope for a future. And that meant a lot to me. Although she has since passed away from cancer, I think that natural medicine did help her to live her fullest life, even after being in bed for 10 years. So, naturopathic medicine just felt right to me and aligned with my inner beliefs about how medicine should actually be. While I was in school, I was consistently more inspired and actually got to witness the magic of this medicine. I enjoyed learning about infinite tools of treatment, nutrition, how to counsel patients, preventative medicine, and modalities of medicine that I've never even heard of and that were super powerful. And I'm just so happy that naturopathic medicine has so many tools in our toolbox to actually help people. The conventional system, I feel like, is pretty limited with the tools that they have to treat people. And their healthcare system is designed for people who are sick and not for people who are healthy, or designed for preventing people from being sick. While I feel like naturopathic doctors have essentially kind of free range with how they can treat people. There's a funny saying that we learned in naturopathic school where you put 100 naturopaths in a room with one patient, and you will have 100 different treatment plans for that patient. And I just really like that attribute about naturopathic medicine. And it just really does drive me with how creative that we can get, which kind of gets me into my next slide here, which is a lot of people ask me, well, what do you like about naturopathic medicine? Why do you go into this route? And what fascinates me the most about naturopathic medicine is this art. There's always something to learn, and there is never a same presentation for a condition, or I never prescribe the same treatment for a condition. And there are always new studies and new protocols that can be learned. It's interesting who responds to certain treatments and who doesn't. So the creativity is what gets me the most. I like to use the example of back pain. So naturopathic medicine uses principles of doing no harm, preventing, treating the root cause, nature as medicine, doctor as teacher, and treating the whole person, which I will get into in another topic, but it'll take too long for me to go through all of that. But what I want to kind of talk about with back pain is more of the therapeutic order. So not only do conventional doctors typically do just symptom relief, just making sure that the function is okay, they'll go straight into something more aggressive. Naturopathic medicine kind of goes and treats the cause, and they go in deep and ask you really deep questions and make you really think about your health and really think about what the core problem truly is. And not only are they treating your back, but the back also represents a lot of other things and acts as a mirror or a reflection of a lot of things that is happening. So the back is the main structure and the foundation of the body. So usually when there's back pain, you have to figure out where the foundation and the structure of somebody's life is and make sure that you are addressing that as well. NDs tend to treat people also. It's not just a condition, not just back pain. So a lot of patients will come to me and say, "Hey, do you treat back pain?" And I say, "Well, yes, but let me shift that perspective a little bit. I treat you as a person, and therefore I treat your back pain." Do you see the difference? It's a little bit of a perspective change. This means that more of a treatment that a naturopathic doctor would do is they treat the whole person, and they try to get to the root cause, and they try to teach you about your back pain, for example. So if somebody were to walk into the pain clinic or the clinic with back pain, we don't necessarily treat the back pain and suppress the pain. Or give a pharmaceutical or a steroid and then get the patient out the door. What we would probably do is ask you 100 questions about your back pain and your individualized back pain, and then usually you would leave the clinic with a whole individual personalized treatment plan for your back pain, because no back pain is identical. And one size does not fit all. So something else that typically happens is, or an example of this would be a fever. So our father of medicine, Hippocrates, says, "Give me a fever and I can cure any disease." Well, research has shown that taking anti-fever drugs do not shorten infections, and even worse, they can prolong infections. So the more troubling thing is that they can prolong the time of it being spread, of the bacteria being spread, when you suppress fevers. So fevers are associated with a better outcome actually in viral and bacterial infections. Therefore, when we treat fevers, we want to harmonize the body to ease the discomfort of fevers and then assist the goals of the fever. So it is with fevers and high temperatures that the immune system works more effectively, and then the microbe will die. The body knows how to heal itself, especially through producing fevers. So naturopathic doctors tend to facilitate the body through the fever instead of suppressing the fever. It's a big difference. So I guess all in all, NDs don't have specific treatments for patients because they're also individualized, and on that same token, treat all conditions that walk in the door. So our limitations are actually only major emergency room care and major surgery, I would say. So some naturopathic medicine that I use in my daily routine, so that you can kind of get to know that I don't just walk the walk and talk the talk. I kind of walk and talk, and kind of, I'm not a hypocrite, I guess, in my form of medicine. And I do a lot of the things that I teach, such as lifestyle modifications. I try to eat really well. I'm very conscious of what I put into my body. I exercise daily because that is my form of mental health, I would say, and taking control of my mental health. I have a lot of good, healthy habit routines in the morning, especially, and during my lunch hour, and making sure that I'm very intentional and very intuitive and listening to my body and letting it tell me what it needs. I tend to overexert myself, so I definitely take an adrenal support because I know that it will help me with being able to keep the energy that I need during the day. Because I exercise, I tend to get pretty sore, especially in my back. And so I love getting cupping treatments done because it really helps me with my personal back pain. Just being an athlete in general, I've had pretty weak ankles and I've had a lot of ankle injuries. So I have gotten platelet rich plasma injections in my ankle, which have helped tremendously. I no longer have ankle problems because of this and all of my old injuries that I've ever had. Homeopathy has been a very powerful modality that I've been using and experimenting with, and I've just found that it really helps me with keeping myself balanced and vital. Hydrotherapy is alternating hot and cold. So I love to jump in cold lakes. Some people would say that I'm a wuss sometimes about it, but I do, as long as there is the alternating hot and cold. So doing the sauna, then jumping into an ice cold lake, and then jumping back into the sauna. So that alternating hot and cold is extremely detoxifying and very vitalizing. And so I recommend it pretty much to every single one of my patients. What else I do is that I recommend to every single one of my patients is something called earthing, which is getting your bare feet in nature. Those negative ions that are coming from nature are some of the most healing and anti-inflammatory free medical treatments that are out there. I also use a lot of herbs in biotherapeutic drainage in more of an acute situation. If I feel like I am getting sick, or if I just feel like certain organs just need a little bit of a boost, I tend to use herbs and biotherapeutic drainage for those. I've had a lot of UTIs in the past and yeast infections and gut health issues. And so herbs and biotherapeutic drainage has been able to be under control because of these things for me. Thank you so much for listening to this, and I hope to meet you soon. If you have any questions, please call my office, and I'm happy to talk to you about anything. And I also offer free 15-minute consults just to see if we would get along, and I look forward to working with you in the future.